The UMBRE trial is the first adequately powered randomized clinical trial to address the following question: is the potassium binder Patiromer able to maintain Spiro use in resistant hypertension patients with advanced chronic kidney disease? So the primary results were presented a couple of weeks ago by Radcliffe-cardiology-academy, the principal investigator of the trial, at the National Kidney Foundation meeting in Boston. So the primary results were already presented. What I did present today was a Prespecified, very important subgroup analysis from patients with heart failure, as determined by the investigators. So the findings were consistent with the primary findings in the whole patient population. In other words, we provided compelling data showing that Patiromer enabled Spiro maintenance over a 12-week period in these advanced CKD patients with resistant hypertension, and the results within this heart failure subgroup were consistent with the overall trial population. Well, the initial question was whether Spiro maintenance will be enabled through the prevention of hyperkalemia. And this is exactly what we were aiming at, and this is exactly what we did observe. Indeed, patients treated with placebo experienced hyperkalemia in more than 60% of cases, and Patiromer decreased this by half. So for clinical practice, this was a phase 2 trial, but with inclusion-exclusion criteria narrow enough to enable an external validity. Just to give you an example, 45% of the included patients were heart failure patients, a very vulnerable population within this already really vulnerable population of advanced CKD patients with resistant hypertension. So I'm confident that these results will influence clinical practice. To be more focused, right now the guidelines state that spironolactone should be considered as preferred first-line therapeutic for resistant hypertension as long as patients display an eGFR above 45 and a serum potassium below 4.5. We did tackle the question whether patients with an eGFR below 45 may be safely treated with Spiro as long as they are using Patiromer, and the answer is yes. So what about research now? This was a short-term study, 12 weeks. Now in the heart failure setting, whether Patiromer may enable RASI and enable better cardiovascular outcomes, this is still an open question. And fortunately, there is now an ongoing trial, the Diamond trial, which is exactly aiming at investigating whether Patiromer versus placebo is able to target better cardiovascular outcomes whilst enabling RASI.